How can we prevent macrovascular complications in diabetes? Wherever you are, you might be at risk of being bitten by a tick. Tick bite may cause serious illness, as bacteria from tick saliva enter the body and cause symptoms like fever, which might develop into organ failure if not treated in time. A bite from the deer tick can cause Lyme disease. A bite from the Lone Star tick causes Rocky Mountain spotted fever. The more ticks you are bitten by, the more bacteria will attack your system, increasing risk for serious complications. What on earth do ticks have to do with diabetes? No, diabetes is not caused by a tick bite. Ticks actually has nothing to do with diabetes. The only tick in diabetes is that of a clock. The cardiovascular clock. This clock might be ticking off time. Is yours ticking faster or slower? When you have diabetes, risk for stroke and heart attack is double that than without diabetes. All over the world, people are at risk of developing diabetes, and many already have. Research indicates that 80% of those with type 2 diabetes will develop and possibly die of macrovascular disease. That is complications that affect the bigger blood vessels in the body. For example, cardiovascular disease, stroke, and peripheral artery disease. Plaque accumulates in arteries that carry blood to the head, organs, and limbs, causing gangrene, amputations, and even death. But this can be prevented if all the risk factors are managed optimally. The Steno study of 2003 indicated that optimal treatment of multiple risk factors in those with diabetes with macroalbuminuria can reduce risk by 50%. Risk reduction to half the risk. Yes, the clock will be ticking half as fast. So which are the ticks or risk factors associated with diabetes? Diabetes already puts you at risk, and you usually might be bitten by hypertension as well, often accompanied by hyperlipidemia or dyslipidemia as well. Obesity might be the first tick that bit you. While you were sitting on the couch smoking in complete inactivity caused by exhaustion from excursions to the bathroom, as HbA1c just won't get below 7, while hypercoagulation, the sticky one, also joined the biting party. How many of these ticks apply to you? The more ticks on your risk, the higher the risk. The clock might be ticking faster until the bomb explodes. Heart attack, infarct, stroke, and often death. When the bomb exploded, the clock usually stops ticking. Be reminded, this is preventable. How? What magic regimen can wipe out half the danger? The untick regimen. Proper management of all mentioned ticks consists of lifestyle adjustment and multiple medications. Strict adherence to application of the regimen in the first 5 to 10 years after diagnosis especially lowers risk, providing a long-term legacy effect. Here follows tick-by-tick management as indicated by evidence-based guidelines globally applied. Weight loss can reverse obesity. Moderate loss of 5 to 10% of weight per year is indicated. Weight maintenance is much better than drastic loss. Healthy eating is indicated by reducing total fat, limiting saturated fat, preference to polyunsaturated, monounsaturated fat, and assuring fiber. Inactivity can be wiped out by activity. Exercise of 150 minutes moderately per week or 90 minutes high intensity per week is indicated. To maintain weight loss, 7 hours of moderate exercise per week should be done. Hypertension can be controlled by keeping the blood pressure below 130/80. Blood pressure should be measured in every visit. If above 130/80 on 2 separate measurements, this is hypertension. It can be managed by weight control, physical activity, reducing alcohol, reducing salt intake, assuring fruits and vegetables, and low-fat dairy on a daily basis. If above 140/90, medication should be added. This will include an ACE inhibitor, probably multiple medications. If multiple medications don't do the job, you should be referred to a specialist physician. Dyslipidemia can be reversed by controlling lipids. Annual monitoring of a fasting lipogram is essential. Lifestyle adjustment plays the first role. Statins, should they be added or not? Above 40 years, yes. In case of overt cardiovascular disease, definitely. If below 40 years of age and one cardiovascular risk factor, yes, regardless of lipid levels. If triglyceride levels are high and LDL cholesterol is lowered, niacin and fibrates may be added. The ideal lipid profile would look like this. First priority would be to have the LDL cholesterol below 2.5 mmol per liters or 100 milligrams per deciliters. In case of overt cardiovascular disease, the target is even lower. Of course, every smoker should quit. Willingness to quit, cessation plans, counseling, and so on should be considered. Hypercoagulation is treated by anticoagulation, usually using aspirin. Who should have aspirin? Men above 50 years of age, women above 60 years of age. Usually in case of one major risk factor: family history, smoking, hypertension, dyslipidemia, albuminuria. Who shouldn't have aspirin? Those who are allergic to it, bleeding tendency, already have that therapy, hepatic disease, or age below 21 years. HbA1c, yes, that's your glucose control. Above 7 is dangerous, so it should be below 7%, even below 6% if there are no hypos. In a nutshell, all the ticks can be unticked. And the clock can be slowed down by the untick regimen. All factors can be improved by healthy eating, exercise, and a suitable type, dose, and combination of medication. In addition to complete application of the winning antique regimen, a bite from one of the only 2 poisonous lizards in the world, the Gila monster, can help even more. This exquisite character is native to Southwest America and northern Mexico and only eats 4 times a year. Its saliva contains exendin 4, which continuously regulates blood sugar levels for up to 12 hours. This is contained in one of the more modernized medications for diabetes. But be careful. It's not just about blood sugar levels. Multifactorial management has been proven to be the 50% risk reduction recipe. Start slowing down your clock today, tick by tick. Your diabetes team will assist you every step of the way.